What's up, you guys? This is Will Miguel giving you your daily dose of radiation. Today's video will cover when it's necessary to have 2 techs for an exam. So, I do night shift. There's only 2 of us at night. During day shift, there's like 5 techs. So at nighttime, there's time where it would be useful to have 2 techs, but it's not always optimal. I would say a lot of the time when there's babies involved, it would help to have 2 techs. Because sometimes the baby will be like, you'll use the mom to hold the head, and like you'll be holding the bottom to get the chest. And then you have the other tech like setting up the technique and doing all that and pushing the button. Same thing with like if they're in the trauma room for cross table, it's always handy to have another tech because you're holding it, and then the other one can like give you maybe a better perspective of if we're gonna clip it or if there's something going on, and like be able to shoot it. Same thing with cross table hip. Occasionally, some of the difficulties is doing a one-man cross table hip or anything cross table or anything kind of where it's like you gotta hold the patient and shoot it. Like it gets very, very difficult. It ain't impossible, it's just very time consuming. I would say if you have to cross table hip by yourself, my biggest advice was set up everything on your portable as far as technique goes and everything like that. Set up your tube, angle to where you think your projection's going to be at. And then when you come back, grab the little deadman switch, the rotor. And then essentially what you're going to do is kind of have the rotor and the board, because essentially for a cross table hip, sometimes you got to press down a little bit and with the other hand kind of lift up. And I mean, you'll be wearing lead. And like as you're pushing down, you're lifting the leg and rotoring, and then you just like beep, beep. And then like put everything down and go and check your images. So sometimes you'll do that a few times because you'll have to make an adjustment. Those just... It's not hard, but it just takes longer. It's easier with 2 people. Same thing with the babies. So yeah, it's been your boy Miguel. See you on the next one.